As coronavirus cases are on the rise, unfortunately, domestic violence cases are on the rise too. To help us sort all of this out, Rhonda Fleming is here from the Women's Center and Shelter of the Greater Pittsburgh region. Rhonda, good morning, and thank you for being here.
Good morning. Thank you for having me.
I'm sure you're busy. So let's talk about the correlation between the rise in domestic violence cases and the coronavirus pandemic.
Thank you so much for asking that. You know, the rise is due a lot to the fact that people, the perpetrator and the victim, survivor of intimate partner violence are in much more close proximity of one another because they're together, you know, because of the quarantine, because of the sheltering. We are seeing everybody having to be home, and the rise actually comes from a loss of control, not being the abuser, not feeling like that they have control of anything. They can't control to go out, to go to work, what to do, and then that puts the victim at home at the same time that the stress is arising. Stress doesn't cause it, however, it does exacerbate it. It makes it really more dangerous.
Yeah, I can see that person feeling like they don't have any control in the world, you know, based on what's happening, and so they probably try to control someone in the house.
Yes,
Yeah.
and you know, we're not talking about cases where there's no domestic violence or intimate partner violence. We're talking about where there's already intimate partner violence. So this isn't to say that the pandemic is going to cause someone who's never been abusive, who doesn't live that lifestyle or have that belief system, is going to necessarily start being abusive. But for those who are already in abusive relationships, that's where it is increasing. And we're really hoping that victims to find ways to call Women's Center and Shelter.
Yeah, and so what are some of the things that you and your organization are concerned about as it relates to women? Like you mentioned before, just being in close proximity for longer periods of time in the home.
Yeah, our concern is safety. It's always our first concern, safety for victims and survivors and the children for living in a home where there is abuse. So we hope that they are able to reach out to call someone. If they can't call the shelter, possibly they're talking to a family member, a co-worker, or someone on the phone or on Zoom or any mechanism that they're using right now, maybe they're able to reach out that way and get help. So there's different ways. These times are calling for different measures. So hopefully they'll use some of the different measures to still reach out. You know, safety being number one.
I agree, and I think about those women who maybe were saving up money and, you know, relying on their job and preparing to leave, and now maybe that's all up in the air.
Exactly. So again, if they can find safe ways to continue to make plans for leaving, and Women's Center and Shelter could definitely help with safety planning via our hotline, over our hotline, which is a 24-hour service. So they can still talk about ways to make plans. And you know what? That can help give people hope. That's what's really important right now, to continue to give hope.
Yeah, okay. And just one more time, how can someone reach out and what do they need to do? Are you guys doing anything different based on what's happening?
Our services and all the services, all domestic violence shelters are still available. We are all available through our hotline. We're available through shelter. We're also on our website, WCSPittsburgh spelled out.org. Please just reach out one way or another.
All right. Thank you so much for your time, Rhonda. Good advice this morning. And if you need any additional information on the Women's Center and Shelter of Greater Pittsburgh, we will have that link for you at pittsburghtodaylive.com.